I'm joined by Dr. Gavin Chan of the Victorian Cosmetic Institute in Australia. Thank you so much for being here and joining me for this little collaboration of ours.
Thanks, Gary. Thanks for having me. It's interesting. We've actually never met before this meeting, so this was a really good thing that we were able to hook up and do this together.
Yeah, absolutely. Yeah, no, thank you. You definitely have inspired me and my channel on YouTube. Your videos and what you've been able to build on YouTube has definitely been very inspirational, so I thank you for that. For this video, we asked our community to please send in photos of themselves for an evaluation of sorts with myself and with Dr. Gavin. And we're going to do our best to give you as tasteful of an evaluation and some feedback based on what those people asked us to talk about related to their facial anatomy, related to different procedures that they're interested in.
Let's do it.
All right. She's 29 years old. She's never had fillers. She gets Botox injections into her 11s and into the forehead roughly 2 times a year. I want to hear your thoughts on that frequency.
I mean, this is a common presentation of a young person who is actually very good looking, and she doesn't really look like she needs too much. Botox is fine here. Twice a year is usually on the less frequent side. Most people would have it, say, 3-4 times a year. A lot of people do have it in their 20s with the thought that it may prevent wrinkles. There's no clinical evidence showing that, but sometimes that, if you do genetically have, say, a very bad frown, then there may be some argument to actually start younger.
Are those common areas that you're injecting with Botox, 11s and forehead, or are there other areas that you find to be more common?
Often they have crow's feet done as well. General rule, I try to dissuade people from having Botox in their 20s so much. I think in your 20s there are other options, and the main ones really to maintain your skin are good health, sunscreen. I think you can start vitamin A, tretinoin, which is quite a powerful anti-aging cream and probably one of the only proven anti-wrinkle creams that are out there at the moment.
Right. No, that's a good point. It's not always about things you can inject into the skin. There's a lot of topicals that are very effective and important. I mean, I like the fact that she's not going for Botox too frequently, because I find that there is risk in muscle atrophy over time, and for people who start really young and they're over injecting or getting injected too often, that could be a problem down the road. Options for someone in their late 20s, early 30s who may be looking for an eyebrow lift, like a Bella Hadid. There are surgical and non-surgical ways of lifting the eyebrows.
Do you do that a lot, Gary? Do you do a lot of eyebrow lifting surgically?
I do a moderate amount of it, but I really try to avoid the patients like her, to be honest with you. I prefer it, like aging face surgeries, I prefer to leave for the kind of aged look. And when I see someone who looks, like you said, as beautiful as she does, I don't think that she needs the brows lifted. She's asking about this little bulge just on the side of her oral commissures out laterally. She wants to know if there's anything that could be done about that little spot. I wouldn't address that in any specific way. I would just let her know that that's a variant of normal.
She's clearly a very fit and healthy person overall. You can see from the contours of her face, and I think that's very attractive. I think you can tell a lot from someone's health and their physique just by looking at their face. It's interesting,
Right.
I think the fitter and healthier you get, the more attractive your face becomes, and she's got a beautiful, attractive face, so clearly she's a very fit and healthy person. But one of the consequences, I think, of her health and fitness is that she's probably got some buccal hollowing there.
I don't think there's anything to do about this. You can see some asymmetry in her face. Definitely the two sides just look different. I think it's more prominent on that right side for her.
Yeah.
But there's not much to do. It's probably just attachment points for a bunch of facial muscles. A 35-year-old transgender woman who transitioned at the age of 33. She's pleased after the results of hormone replacement therapy for some degree of facial feminization, but still looking forward to surgery to feminize other portions of the face, in particular the brow, forehead, and nose. She feels is still very masculine, so we can take a look at her images here.
What a transformation from before and after. I don't see a large number of patients in similar situations, but occasionally I do see this, and I guess what we're looking at here is trying to feminize. From a non-surgical point of view, you could look at feminizing the face with something like fillers. So I believe a surgery, which we don't have many people in Australia performing this sort of surgery, but is to sort of take down the bone of the brow. I don't know many people who do that sort of surgery, but in terms of a non-surgical alternative, one thing that could be done is to fill the concavities of the forehead instead of taking down the brow. I don't think it would have as dramatic effect, obviously.
It would make sense if she seems to be interested in surgery, to do like the brown bone reduction surgery. Not something that I do in my practice. I don't have like a very active like facial feminization surgery practice, but I do work with transgender patients on a lot of lip lift surgeries and hair transplant surgeries. So that we do a lot of hairline lowering. In terms of her mid-face, I think a rhinoplasty makes a lot of sense. And then there's, of course, the lower face. And any thoughts, especially non-surgically, Gavin, on her lower face?
I mean, non-surgically, a lot of women identify with their lips as a very feminine point of their face and sort of part of their sensuality. So I think lip filler in this instance may be of some benefit.
One other thought for non-surgical: what about masseter Botox? Do you think that might be effective in her case?
For sure, absolutely. I mean, you can see there's definitely some masseteric bulging there, which is masculinizing.
For the lips, I think also if we're doing a rhinoplasty, adding a lip lift would make sense. I like how the shape of the upper lip is very horizontal. There isn't much of an arching to it. Every time I do a lip lift, anyone does a lip lift, there's an increased arch effect. So when people are starting with a very arched lip, like actually our patient from before, it accentuates that arch, which isn't always ideal.
Get a Joker look, do you?
Yes, it can, like a frowny type of look. But when you start off with a very flat upper lip, it actually makes it look great, by giving it a bit of a natural arch. And so the bottom lip also in her is full enough to handle the upper lip getting fuller and more arch. So I think she's a really good candidate for the lip lift. This is someone who sent in a couple of pictures and a bit of a general request here for feedback on her nose and lips. When I look at her frontal view on the same slide, the philtrum looks a lot longer, but then when I look at that profile view, I'm seeing like a projected sort of upper lip, and it's almost making the philtrum, it's giving the illusion of a bit of a shortening there, but it just looks more projected. So that's something I would wonder if she had some lip fillers placed. I do think that her nose is attracting probably too much attention. I mean, people forget this, but what you want out of any aesthetically pleasing nose or out of any surgery that addresses the nose is you want there to be less attention on the nose and for the focus to be on her, like her beautiful eyes, for example. But you want the focus away from the nose. When I look at her, it just draws me into the nose. So I do think she'd benefit from a rhinoplasty to address the tip bulbosity. There's a wide nasal base on her face, and the tip itself does not have much character or definition. So creating that, I think, would help her quite a bit. Like, what about non-surgical rhinoplasty, Gavin? I mean,
I was going
to
bring that up, actually. Funny you say that, because I would get a lot of people who actually want to have a non-surgical rhinoplasty for the purpose of, say, narrowing the nose or making it look smaller. And I think what they've got to realize is that non-surgical rhinoplasty or liquid nose jobs with filler are only an additive process. So as opposed to rhinoplasty, surgical rhinoplasty, which you can take away stuff, I can only add. So I would not say she's a great candidate. I mean, it's hard to tell in the photos, but she may have some very minor sort of dorsal hump, a little bump there, which you could disguise by putting a little bit under and above it, but you do this at the risk of making your nose look bigger.
And the lips, I think it just depends on the angle that I look at her from, but they look appropriate as far as I can see. I mean, I have patients who come in who look similar to her who, ask me for lip lifts, and I'd have to evaluate her kind of on repose, where it's just like a mouth open type of view without like the head being angled in all different ways, just to see the position of the teeth and to really get a better sense of philtral length. And so I'm not really seeing that here, because in the first image she's kind of smiling, so it's just hard to tell if she'd be a good lip lift candidate. This gentleman is 19 years old, and he says that he's been considering procedures such as infraorbital implants and acanthoplasty, and he wanted to just get a general sense of what our thoughts are on that. And then he also has a question here about baby Botox. I guess the idea of like a prejuvenation or preventative Botox. He's 19, young guy. What do you think, Gavin?
He's a good-looking guy. I reckon he probably should go on the next next episode of Twilight. He looks like, to me, that sort of. He's the next. I've forgotten his name now, but he looks. He could be. This guy could be a movie star. He doesn't really have any aesthetic issues. Nothing I can see that sticks out. But the fact that he's worried about his tear troughs, to me, is a red flag. And to me, this looks more like something like he may have some sort of dysmorphia, and body dysmorphia. So what he perceives as looking bad may actually be not bad at all. And there are things around the eye naturally that you can get genetically, like maybe a little bit of darkness or some hollows there naturally. But in this instance, they don't detract from his appearance. To me, he doesn't look tired.
First of all, he strikes me as having almost like a androgynous type of look, which I think is a beautiful thing. There's like some slightly feminizing, like the lips have like almost like a feminine feature to them in part, and almost like the eyes, like the width of the eyes and the thick brows, but then again his jawbone is very masculine.
Yes.
And so he has very interesting features, and I think could definitely be some form of a actor or something, which is great. The under eye hollowing, yeah, I mean, it's there.
This is our topic, Gary. This is the one we can talk about and debate about.
Oh, yeah. Well, more and more, to be honest with you, Gavin, I've been referring people out for this exact
Is that after you saw
thing.
my video on why I stopped filling tear troughs?
Yeah, I'm like, I got to send them out. I'll do like a lower bleph for an older person where there's like, pseudo herniation of fat, and it's like straightforward. But I get a lot of younger patients in my practice, and some of those patients are asking me for like under eye surgery, and these are very young patients where the problem isn't always so obvious as we're looking at with this gentleman. Could there be some improvement? Could you smooth out that hollowing with fat or a lower bleph? Sure, there are people fully capable doing that and doing it safely, but I'd rather these young patients be in the hands of someone who's doing this all the time. Well, this has been really awesome, Dr. Gavin, and thank you so much for joining me. Thanks for all the work that you do in your practice and also through YouTube and educating all of us. And thank you to all the people who sent in their photos. I think that's really brave of them to be open to sharing. They were just very kind to do this, to give us the permission to talk about them for all of your viewing pleasures. So hopefully you guys learned something.